All right, so we're back with another Tuesday recap of taking conversations from Zach's time with clinicians on our team and just being a little bit more transparent here. So one of the things that I know frequently comes up, but it involves exercise progressions. I think we can all agree that when you're going through your time, especially that early part of the plan of care, your sessions with someone, you're trying to get them comfortable with specific movements, and then you're trying to find a way to progress. You're adding variables. There is a lot of directions you can go in. Very few times is there one specific choice that is the absolute best. Instead, there's multiple options. You're considering things that are going on with their injury, involving time and criteria in particularly. But Zach, I know there's a lot of different directions to go in when talking exercise progressions, but what are some things that you're thinking about early on and then as you go along with working with somebody?
I think you really need to approach this just from a very aerial view and appreciate what are the different dials that we can turn or factors that we can influence and manipulate. And if we think about exercise, I think you just break it down into different movement archetypes. So we have our squatting, our hinging, our lunging or stepping progressions. From an upper body, we have push, pull, press, carry. So I think that gives you kind of your overarching alley that you're working within and that you're trying to progress. And then when we talk about progressions, you can really break it down into either spatial, temporal, or load parameters of what we're trying to manipulate. And what we mean there is things from a spatial standpoint in regards to what is the stance that we're operating within. And we can take a squatting movement and do that in a variety of different stances. Is it bilateral? Is it unilateral? Is it symmetrical? Is it asymmetrical? Is it narrow? Is it wide? Is it staggered? So I always like to think about spatial in regards to how can we modify stance in the most logical way. When we talk about temporal, we're thinking about the time aspect component to it. So what are we communicating to them in regards to how they are moving? Are they static or is it a dynamic environment? So is it just an isometric or an isotonic activity? With that, we can then further break down the isotonic into either an eccentric or a concentric emphasis. Or maybe we just want to have a very intentional way in which they're moving with regards to having a slow or fast rate of movement. So maybe we're thinking about like a 3-second down, pause at the bottom, 3 seconds up, where we're having a very slow, deliberate, or maybe it's just a natural movement on a 1 second down, 1 second up. And then I think the most obvious of which is the load, which is what we're all most kind of comfortable or at least familiar with, which is where we're manipulating set, reps, intensity, volume, frequency. Those are, I want to say, the more straightforward parameters because that's as simple as what can they do well and how can we make it a little bit more challenging. So I think what we need to do is define the movement that we're interested in and then figure out what's a systematic way that we can progress this. And like Josh mentioned, there's not necessarily a right or a perfect way to do it, but we need to have some sort of way that we're monitoring what, and more importantly, how many variables we're changing from one exercise progression to another, and what's the rate limiting factor in regards to what's least likely to have an adverse reaction to this, or if we do have an adverse reaction, what's our safest to fail variable that we can manipulate? Meaning, if things don't go well, the worst case that happens is they learn a little bit more about themselves and how they move, what they're good, what they're not so good at, and we're not having a re-injury or a significant flare-up or adverse event to this.